Today's video topic is how to differentiate between heart attack and ulcer pain or acidity pain or acid reflux pain. This is a very important question, and everybody should know how to differentiate it. And the first thing is both will have a similar type of pain. Usually, both the heart attack as well as acidity or ulcer pain usually will be around somewhere around here, the middle of chest and the upper part of the stomach, and both of them can have nausea, vomiting. These are both are common to both heart attack as well as ulcer type pain. But how to differentiate these two? Usually heart attack is something like very compressive, excruciating pain, as if an elephant is standing on you, on your chest. It's a crushing, excruciating pain, and you will have a sweating, cold sweat. You will have a cold sweat, and you will be gasping, breathless. You cannot breathe. You can't even walk. Walking is very difficult. The pain usually originates here because your heart is here, so it can originate from here and it can go mostly on the left side. It can go up to the jaw or even the left shoulder, even to the arms. The pain will be excruciating, crushing pain with breathlessness, and you can't even walk, followed by sweating, nausea, vomiting, sometimes giddiness, all these can happen. This is for the cardiac pain. Usually this kind of pain happens in the late night or in the early morning times. Usually it can happen anytime, but this is a usual thing. And usually there will be history, family history, father or even uncles, in that young age they will have a cardiac heart attack, the young age, and there will be the patient may be 40 years, male, smoker, alcoholism, and other metabolic diseases, diabetes, cholesterol, all these things. There will be a history of all these things, and if you have that kind of pain, as if a small elephant is standing on your chest, it could be a heart attack or something pain related to the heart. And contrary, the acidity or ulcer, acid reflux pain usually they will have a previous history. The pain, they'll have even at the young age itself. I used to have this kind of pain from my childhood, maybe the college times, all this. They'll have a previous history, and most of the time, the pain sometimes may be more of a burning sensation, and it can also be followed by nausea, vomiting, and mostly this kind of pain happens with fatty meal, fried items or cheese, mayonnaise, oil, or heavy meals, feast. After that, this kind of pain can happen. So usually, when in doubt, always think about something very serious, something like a heart problem, and take precautions. So generally we say if you have more than 40 years, male, smoker, hypertension, cholesterol, diabetes, and family history, young age cardiac attack, and your gut feel says something is really wrong, and you're gasping, you can't walk, the pain is crushing, then it could be a cardiac thing, and seek for help immediately. If you have, as a first aid, if in your home, suppose you have a aspirin, you can have 300 to 350 milligrams of aspirin, that can, prevent clog. These are blood thinners. They can prevent the clotting of the blood vessels, the small blood vessels, so the pain can be relieved. In ulcer pain or the acid reflux, they are where if you have an antacid or if you have a cold water, they feel little better. But here in cardiac problem, they won't feel better. So it's always better if you think, if you have aspirin, you can have aspirin and immediately go to the nearest emergency where the doctors can ask for, to diagnose their cardiac, to rule out at least. They will do a ECG, they may ask for a X-ray, even they will ask for some blood tests like TROP-T or troponin test. If they are positive, then they will give the vasodilators to dilate the blood vessels. So these are the treatment pathways. So even we gastroenterologists or gastroenterologists or anyone, we always think, anyone above 40 years and all, first we always think about cardiac. Once we rule out, then we have time to investigate and the acidity part. So if you are above 40 years, male, smoker, alcoholism, diabetes, cholesterol, hypertension, obesity, family history, and something excruciating pain, crushing pain, as if an elephant is standing on you, gasping for breath, it could be a cardiac one, and take proper treatment and proper precautions. Thank you.